Hello, it's me again, Jeremy Latham, the hip surgeon. This is a busy time of the year for orthopaedic surgeons like me. It's early February. People have put up with their hip symptoms over the Christmas holidays and they're thinking, you know what, I don't want to spend another year with a painful arthritic hip. Many of my patients don't have health insurance, so they choose to pay for themselves. Now, private healthcare is not cheap. A hip replacement in the private sector will cost you anywhere between £12,500 and £13,000, which is a lot of money by anybody's reckoning. So why would you choose to spend that money when you could have a hip replacement done on the NHS for nothing? Well, people get frustrated by NHS treatment. They have to wait a long time and often get cancelled at the last minute because of winter pressures and sick patients coming into the acute hospital. Now, that's not surprising and it's entirely understandable. So why would you choose to come and see me? There are plenty of hip surgeons out there after all. Well, I offer a very personal service. I was in the NHS for 17 years. I left a few years ago, as many of you know. I'm much happier in independent practice because it means that I can offer a very personal service. I have the time to do that. All of my patients get my mobile phone number and my email address. You're free to contact me at any time for advice. Lots of my patients do, and I'm very happy to receive calls and receive emails and give advice, which I hope is helpful. And that's very reassuring for a lot of patients to know their surgeon is there and able to give them specific advice at different times of their surgical pathway, whether that's before surgery or afterwards when they're rehabilitating from their hip replacement. So it's all at the end of the day about value. I've been around for quite a long time. I've been a hip surgeon for 20 years, so I have a local reputation which I hope is favourable. Many of my patients come back to me to have their other side done, even after several years or so, and many of my patients recommend their friends and family to come and see me. I really value that because I'm part of a local community and I want to do the best that I can for my patients. So if you're thinking about having a hip replacement done and you don't have health insurance or you're fed up with waiting for the NHS, self-pay is an option. The Wessex Nuffield Hospital, which is where I do my surgery, does have finance packages and we can give you information about that if you contact the office. I have two fantastic secretaries, Anne and Tracy. Their numbers will follow at the end of this video presentation. They're brilliant. They've been with me for many years, particularly Anne, who's been with me for nearly 20 years now. So we offer a very cohesive, very coherent service, which is very personal and tailored to your requirements. If you like this video, please do hit the like button and do subscribe to the channel. I'll keep churning these videos out from time to time. I hope you find them useful. Please do comment below if you've got anything you'd like to talk about particularly, or you have any comments about the videos in general. Thanks again for watching. I'm Jeremy Latham. I'm the hip surgeon.